The state's leading doctors releasing a joint statement today urging parents to vaccinate their kids against COVID-19. Here to answer your questions is Dr. Kristen Moffitt, an infectious disease specialist at Boston Children's Hospital. Thanks for being here, Dr. Moffitt.
Great to see you, Dr. Moffitt. Thanks for your time. So this plea is signed by the Mass Medical Society, the Mass Academy of Family Physicians, the state chapter of the American Academy of Pediatrics. So can you explain the timing and why make this appeal to parents right now?
I think the most important thing driving this appeal and the timing of it is that cases are rising. And we know that children are also accounting for an increased percentage of COVID cases, largely because they remain unvaccinated. And while breakthrough infections in vaccinated individuals do happen, we still know that vaccinated people are much less likely to become infected than unvaccinated people. So by increasing the proportion of our population that's vaccinated, it really remains one of our most effective ways at controlling the spread of COVID-19. I would also just add that we now have over 3 million 5 to 11-year-olds in this country who have been fully vaccinated against COVID-19, and the Pfizer series in that age group continues to demonstrate an incredibly reassuring safety profile. So if parents were waiting to see that the safety data in that age group holds up in larger numbers of children, it has, and the time is now to get your child vaccinated to keep them safe this winter.
Okay, message received, Dr. Moffitt. So we know that the littlest, they're still not eligible. As for those who are, most are not eligible for a booster shot. So do you believe that 2 doses of Pfizer or Moderna is enough to protect them this winter, even against the new Omicron variant?
Yeah, we do have both laboratory data and now data from Omicron infections that the effectiveness of the 2-dose Pfizer series at preventing infection with Omicron is decreased compared to the effectiveness of that vaccine series against infection with other variants, but it doesn't decrease to 0. There still is an impact there and a protective effect. So vaccinating children with that 2-dose series remains one of the most effective things we can do to keep them protected against both the current Delta surge, but also against Omicron, which we may be seeing more of. I would add that combining that with other measures like masking indoors will be really critical as we are experiencing these rising cases too.
And forgive me, it is just Pfizer.
Just Pfizer, yeah.
Just Pfizer.
Dr. Moffitt, do you have time for a couple of questions from viewers, okay? So
yeah.
Let's go to Izzy. Izzy wants to know, why don't kids under 2 have to wear face masks at Logan? Is it dangerous?
Yeah, in general, face coverings are not recommended for children under 2 because it can be dangerous. Children under 2 may not have the wherewithal or the motor control to be able to move a mask if it were getting in the way of their breathing. So it could be either a suffocation or a choking hazard. So that's why it's not recommended to put a face covering on children.
That's a good explanation, yeah.
Okay, well, we have another question from a viewer, this one from Marianne, and she says, my grandchildren, they're too young to get vaccinated for COVID. Is there anything they should eat or take to boost their immune systems?
Yeah, it's a great question. There haven't been any studies that have shown that any specific vitamin or mineral supplementation is specifically effective at preventing COVID-19 infection. But in general, being in good health at baseline, which for those children really means having a really well-balanced diet, hopefully having a good sleep schedule and staying active and getting plenty of exercise are the best things that they can do to keep them healthy and protected.
Dr. Moffitt, thanks for your time.
Sure. Good to see you.
Great to see you.
Great to see you. Thank you.